Head lice prevention in school-aged children by Morgan Lice, Darcy Mayer, Jessica Thies, Maddie Larson, and Camille Gray.
Pico question. Does educating school-aged children at risk for head lice on preventative measures decrease their susceptibility to head lice compared to those who are not educated on the topic? The methods used were databases that include CINAHL, Medline, and Science Direct. The following keywords were used: children, head lice, pediculus humanus capitis, kids, school-aged children, elementary schools, education, and prevention.
Head lice can cause a variety of symptoms, including an itchy scalp, scratching, swollen lymph nodes, pink eye, a lack of sleep, and social isolation. Head lice is highly transmitted, and it is easily spread to individuals through sharing items, bedding, clothing, through close contact, and due to overpopulated areas, including living conditions. Our group had difficulties finding relevant articles within the last 10 years, as one of our articles date back to 2006. We were able to find a lot of Level 2A articles, but finding Level 1 systematic reviews proved to be a struggle, and we were unable to find any relevant systematic reviews. In 2020, an article by the authors Mohammed Poor and others held a study involving 176 mothers of female primary school students in Iran during the academic year of 2018 to 2019. The authors aimed at determining the effect of education on the promotion of head lice preventative behaviors in mothers. The authors determined that there was a significant difference in preventative behaviors and awareness in the intervention group after education. The main difference in awareness score and preventative behaviors between the test group and control group showed a significant difference, and this proved that education on preventative behaviors is effective. In 2018, the author Yinkling and others held a study on the effect of their own health education program for increasing knowledge, changing attitudes, and promoting preventative practices to reduce the prevalence of head lice among schoolgirls. The authors selected schools using multi-stage cluster sampling and simple randomization. The sample size included 180 individuals, with 90 people within the intervention group and 90 within the control group. After education to the intervention group, the overall prevalence of head lice decreased 44%. Preventative practices were significantly correlated with attitude and knowledge in the intervention group, and teaching at schools also positively correlated with preventative practices in the intervention group.
Najari and other researchers conducted a study of random selection to research the effect health education has on prevalence of head lice. 594 students were provided health education on ways to reduce head lice risk. The remaining 311 students received no interference as a control group. The researchers concluded that there was a significant difference between incidence of head lice and family size, as larger families were found to have increased frequency of head lice. Head lice incidences were found to decrease from 8.4% of children in the intervention group to 3%. Rates of head lice in the control group shows no upward or downward trend, as the students showed rates of 9% in the fall, 12% in the winter, and 11% in the spring. Moshki and other researchers conducted a randomly selected study using 79 students from elementary schools in Iran. 87 of the students were put in an intervention group, and the remaining 92 students were put in a control group. Questionnaires were provided to collect baseline information, and education on prevention were designed based on the educational needs indicated from the questionnaires. The intervention group were told to participate in a 3-session course of preventative techniques, and then were asked to utilize peer education as a teach-back method. Results showed that both the intervention and control group showed no significant difference in knowledge of the topic of head lice prior to implementing the intervention, but there does show to be a significant difference in mean scores between the intervention group and control group, as the intervention group shows to have a significantly higher scores of knowledge, self-efficiency, behavior, perceived susceptibility, severity, and benefits 1 month after given the education.
A study by A study by Ozedmir and colleagues in 2019 included 491 high school students who received education at 2 different schools. A personal hygiene questionnaire was taken between September and December of 2018. The forms included socio-demographic questions related to income, living conditions, and personal hygiene characteristics. A head examination was also performed. There was a statistically significant difference between the students who washed hands before a meal and kept clean short nails than those who did not. A correlation also existed between the 2 schools, which was thought to be due to income level, as one school was a fine arts high school and the other was a technical vocational school. A study completed in 2013 by Shravani and others included 153 students who were randomly selected from a primary school in Iran. The students were divided into control and intervention groups. The intervention group was given a health promotion program which included education, a questionnaire, a checklist, and a head examination. Overall, the health education program had a positive effect on the reduction of head lice. The infestation rate was 69.3% for the intervention group prior to the education, which decreased to 26.7% after. However, the control group did not see the same difference, as their infestation rate was 82.1%, and with no intervention and no education, there was not a significant difference.
In 2008, a cross-sectional study was performed by interviewing the heads of 100 randomly chosen residences within the study area. Interviews were conducted in each household about their head lice status, number of residents per household, symptoms, and education level. The study found that 13% of the sample were infected with lice during the first week of the survey, and 86% were within 24 weeks prior to starting the survey. The number of positive cases increased as numbers of residents increased and decreased in houses with higher education levels. The most common symptoms of lice were itching and compromised sleep. In conclusion, the study found that certain beliefs generated worry and confusion in parents. The implementation of an education program to teach the heads of households about head lice would not only decrease confusion and worry, but result in lower number of incidences. In 2008, a cross-sectional study was performed by interviewing the heads of 100 randomly chosen residences within the study area. Interviews were conducted in each household about their head lice status, number of residents per household, symptoms, and education level. The study found that 13% of the sample were infected with lice during the first week of the survey, and 86% were within 24 weeks prior to starting the survey. The number of positive cases increased as numbers of residents increased and decreased in houses with higher education levels. The most common symptoms of lice were itching and compromised sleep. In conclusion, the study found that certain beliefs generated worry and confusion in parents. The implementation of an education program to teach the heads of households about head lice would not only decrease confusion and worry, but result in lower number of incidences.
In 2006,
In 2008, a cross-sectional study was performed by interviewing.
In 2006, a study was conducted that used a sample of 472 11-year-old children who were screened for head lice. They divided the children into 2 groups, the control group and the intervention group. The control group received a treatment protocol and fine-tooth comb, while the intervention group received treatment protocol, a fine-tooth comb, and were provided lice prevention education. The results showed that the group of students who received education showed significant improvement in total knowledge, with a decrease in cases of head lice compared to the control group who received no education at all. In 2009, a descriptive study was developed to identify schools' personal beliefs regarding the efficiency of the existing lice policy. The target sample included school nurses, principals, secretaries, and teachers from the 5 school districts within the Midwestern state. They conducted the study by using questionnaires that were 9 questions organized on a Likert scale, using multiple choice and single open-ended questions. Descriptive statistics collected from the surveys were analyzed and found that the students were routinely screened in the classroom. About 23% of the teachers reported that screenings were insufficient. Most of the participants reported that their main source of education came from the school nurses or other medical professionals. Only 5 respondents out of 217 listed evidence-based guidelines as a source of information. Despite being from the 5 different school districts, respondents consistently suggested minimal knowledge evidence-based management in the classroom.
After our group collected
In 2009,
After our group collected relevant information based on our topic, we concluded that there is strength A evidence to support the implementation of education and preventative practices in reducing head lice in school-age children. Several articles that we researched recommended a head examination to decrease the prevalence of head lice. A few of the articles discuss proper hygiene and application of hygienic practices to prevent head lice. After further research, we did not find any studies that presented education virtually, which could leave out a large population of individuals. Parent education was mentioned in most of the articles, which stressed the importance and involvement of them to prevent head lice from occurring and spreading. Costs may become an issue with treatment, however, affordable treatment options do exist, but are not mentioned within our chosen articles.
In conclusion, the research that was performed supports the utilization of head lice prevention education programs to school-age children in hopes to reduce the incidence of head lice in children at risk. Health promotion of head lice should be provided to students and their parents to prevent transmission within the schools. Education can be provided in many forms, including brochures, surveys, questionnaires, in-person lectures, or meetings that include the parents. For those facing financial hardships, low-cost treatment is available to them. And lastly, head lice can alter the way people view individuals who carry the bugs, meaning social support is key, especially for younger individuals.
Some patient preferences to take into consideration is, are they willing to participate in health education or willing to have their hair touched for examination? Do they have any access to resources related to hygiene? Do they have any privacy concerns over the use of questionnaires? Are the parents willing to participate or is accepting of their child participating? Due to the social stigma surrounding head lice, social isolation and judgment may occur, making the patient not want to participate.